Hi, hello, good evening, everyone. So we are back with another Ask Me Anything session. Today is the 68th episode of Ask Me Anything session, and we have Dr. Kavitha Gautham ji from Chennai. She's the director of Bloom Birthing Center in Chennai. She's also the executive committee member of Tamil Nadu chapter of IAGE. She's from Chennai. She has decades of experience. She's also an experienced infertility expert, apart from being an obstetrician and a gynecologist. She's also the South Zone coordinator of her Foxy's Sexual Medicine Committee. We're so happy to have you today with us, Dr. Kavitha ji. So for the first 10 minutes, Dr. Kavitha Gautham will explain, give us 5 important tips to boost the immunity during pregnancy. And next, followed by, she'll take all your question and answers. So please post your questions in the comment section, and Dr. Kavitha ji will take them soon. Over to you, doctor.
Okay, thank you so much, Ravi, for the introduction. Since immunity boosting is something which is very, very prime importance during the current scenario, I think every pregnant woman should know about how to boost up their immunity right now, because pregnancy by itself is a state where the immune system is little lesser compared to the general population. So how do we boost this immunity, and what kind of diet and supplementation will help us is something which I wanted to address on. So the diet which might help us would be a diet which is well balanced, less fat, less to reduce the amount of junk food in our diet, and also look at the ingredients in the diet. With increasing more amount of vitamin C, rich fruits in our diet. Vitamin C is known to have anti-inflammatory and also has a very important role in boosting up the immunity. So vitamin C is there in our fruits like citrus fruits. So probably we can increase our vitamin C in our diet, and also taking more amount of our traditional food items like turmeric. Turmeric is a very potent antiseptic. So turmeric is very good. Garlic, ginger, and black peppers, and even bell peppers are very good immune boosting diet or food items. So by increasing these kind of food in our everyday diet will definitely help us to improve our immunity. And also looking at non-vegetarian diet, probably a chicken broth. Chicken is something which can act against the virus. Chicken with a lot of pepper in it. Chicken broth definitely boosts our immunity. And also, as looking at supplements, supplements like vitamin C tablets, also supplements like zinc, are proven to have a better immune boosting capacity. So everyone should take a vitamin C tablet or a zinc supplement as a tablet. Is very important. It is proven also. The other most important thing which has been proven in literature is vitamin D supplementation, because vitamin D has an anti-inflammatory effect. It works on a body and definitely prevents the viral load. They say the amount of viral load in our body is little minimized by taking such supplementation. The supplementation is not going to completely prevent us from the infection, but definitely it will help us in reducing the viral load, or getting into severity of the disease is reduced by taking such supplements. And other important thing which other than the diet is everyone should definitely practice breathing exercises. Breathing exercises like yoga definitely will help us 30 minutes to 40 minutes, 45 minutes a day. Any pregnant women, please continue doing a regular exercise by which itself our immunity is boosted, and definitely it definitely helps us in preventing infections entering into our body. And also the other important thing is drinking adequate amount of water. By drinking adequate amount of water, our body is generally getting purified. So definitely 2 to 3 liters of water or any liquids per day is very important. And also the sleep. So everyone should also concentrate on sleep, adequate amount of sleep. That is, in pregnancy, I do understand the sleep is very much disturbed, but please, at least undisturbed 6 hours of sleep is very mandatory during pregnancy. And in general population, sleep hours of somewhere around 7 to 8 hours undisturbed sleep is very important to keep ourselves fit and also to boost up our immunity. So these are something which I thought everyone at this current scenario, it is very, very important for everyone to keep ourselves fit and mentally and physically.
Thank you so much, Doctor. So we have so many questions. Many people want to
Yes.
know, discuss their questions personally with you. So shall we start taking questions?
Yes.
Yeah. So first question by Geetanjali Anup. She's Doctor, is consumption of eggplants harmful during pregnancy? Some say eggplants, brinjal.
Yes. Brinjal.
Yeah. So some
So
say
it is a myth actually. Everybody says brinjal, even in general population, leave alone the pregnant group. Even in general population, we think brinjal causes a lot of allergy and allergy-like symptoms. So there are people who get into such allergy due to eggplants. But during pregnancy, for a woman who's been always having been used to taking brinjal, I think you can continue taking brinjal. No harm in taking it. But a person who's already having an allergic symptom to it, probably those people can avoid. But generally, or completely avoiding brinjal during pregnancy is a myth.
thank you so much, Doctor. She says that it induces preterm labor. She heard so. So how far it is true, she wanted to know. Thanks for clearing the myth.
So I don't think it induces preterm labor.
Right. Next question, Geetanjali again. What foods or veggies should be strictly avoided? Will any veggie causes preterm labor or harm to the baby in any way?
There's no food as such which causes preterm labor. Basically, preterm labor is caused because of infection entering into our uterus or into our vaginal area. So, keeping ourselves hygiene, preventing white discharge and vaginal discharges or any infection in the vagina is something which is of prime importance in preventing a preterm labor. Other than that, keeping ourselves fit by not getting into too much of obesity, and also preventing gestational diabetes, also preventing hypertension during pregnancy. These are all very important because these are all diseases which can end up bring you into having a preterm labor. Otherwise, there is no food item as such which can cause preterm labor.
Thank you, doctor. Thanks for clearing the myth. Next question, cuteness altogether. She is asking. She's having constipation from the last 20 days. She's 15 weeks pregnant. She's having also headaches on daily basis, and she's taking Nisip painkiller. And please help how to overcome the laziness and how can she avoid the smoking cravings. Actually, she asked 4 questions, I guess.
Okay.
Constipation
So
from the
first
last
one thing is constipation. So I think to prevent constipation is you have to take a lot of fiber in your diet. If your diet is not having adequate amount of fiber, definitely you will end up having constipation. And also liquids. You should focus on taking a lot of liquids because a lack of liquid and dehydration can also cause constipation. Smoking definitely should be avoided during pregnancy. That is something which is directly proportional to having a preterm labor. So you have to avoid smoking during pregnancy. What were the other two questions?
Okay, she's asking about headaches. She's taking a painkiller and how to overcome the laziness.
Laziness is a part of your pregnancy because you feel extremely tired, you feel sleepy, you feel you definitely feel energy less during pregnancy. This is a part of your pregnancy and you have to mentally overcome it. You have to just take this, consider this as a part of pregnancy, and it is going to be with you till you deliver. So you have to motivate yourself, indulge yourself in regular fitness activities, and um, engage yourself all through the daytime with some kind of physical, or you can study, or you can indulge in some kind of activity which will definitely divert yourself from being lazy. Otherwise, feeling tired and lazy is something which can happen for anyone during pregnancy. And also taking a lot of nutritious food. Probably if you're anemic, you have to check with your doctor. If you're anemic, you will again feel very tired and physically very weak. So probably you have to concentrate on your diet, take a lot of fruits and vegetables, drink a lot of liquids, and check your hemoglobin.
Thank you so much, Doctor. Dr. Narendra Malhotra is welcoming you to the iMumz Ask Me Anything session.
Yes, thank you.
Next question by Kiran Modi. She's 13 weeks pregnant. During the NT scan, she got to know that she have septum in uterus. Is it harmful?
Septum in uterus definitely is harmful. If you're planning for your pregnancy, please get rid of that septum which is there in the uterus, because definitely it can endanger the pregnancy, prevent you from having a term pregnancy. Probably you can end up having a preterm labor or miscarriages, or sometimes by itself can cause infertility. So definitely septum inside the uterus has to be evaluated. If it's a very mild one, probably we can leave it alone. But if it is a bigger one, it has to be removed before you plan for your pregnancy.
Thank you, Doctor. Next question by Samata. In which week quad marker test should be done? She's 19 weeks pregnant.
I think quadruple test is what she's asking about. I think it should be done somewhere between 17, 18 weeks, even 19 weeks. It can be done.
Thank you, Doctor. Next question by Smita Sharma. She's having pain in the vaginal bone area. How to avoid that and what to do?
Vaginal bone area during pregnancy is very common. As the baby grows, your discomfort in the vaginal area is going to increase. So you need not be bothered about this vaginal discomfort, because it is part of your pregnancy. And if your body is getting prepared for a normal delivery, natural delivery, definitely your pelvic bones has to expand. So when this expansion happens, you will have pain in the vaginal area. And when the baby grows bigger, when the baby crosses 1 kg of weight, definitely you will have discomfort and heaviness in the vaginal area. So you have to do some regular physical activity, especially pelvic exercises. Doing regular pelvic exercises might help us relieve this pain to an extent.
Thank you, Doctor. Next question by Survi Chaudhary. She's 36 weeks pregnant. From the last week, she's facing itching on the body, whole body, especially in the night. Yesterday, she did the alkaline phosphate test showing 194.7, and the range is 25 to 147. And her SGPT result is showing 12, which is within the range. Is it something serious? She read that alkaline phosphate is due to liver problem. She's taking Udiliv 300 tablet.
Okay. See, getting itchiness during pregnancy is because of your elevation in the liver enzymes. So unless and until your liver enzymes are under control, you need not be bothered so much. But definitely itchiness has to be reduced, because you will not be able to sleep properly in the night. Sometimes I've seen women with a lot of scratch signs in their skin, because it's so itchy and dry. So first thing you have to do is apply a thick moisturizing cream, like whatever thick moisturizer you have, you can apply in your body twice a day, morning and night. So sometimes it could be because of dryness, just a simple dryness of the skin, which could be prevented by applying thick moisturizer. And also, if your alkaline phosphatase is a little elevated, but that is common during pregnancy, so you need not be alarmed because of the raise. And SGPT seems to be in the normal range. So I think it is a mild pruritus of pregnancy, pups of pregnancy we call it, and taking Udiliv is quite useful. And probably if it is more itchy, you can take some anti-allergic tablets which can prevent the itchiness for some time. Until and unless it is a bearable one, I think you can go ahead with your pregnancy. If it is really unbearable, you're not able to sleep, or it's like very troublesome, probably sometimes we will start them on steroids, which will help them. So this is part of your pregnancy, and it is due to pregnancy.
Thank you, Doctor. And her baby is weighing 200 and 2,500 grams. Is it okay? She's asking.
What baby's weight?
2.5 kg.
At what weeks?
36th week of pregnancy. Same Surbi, same question.
I think that is fine. 36 weeks and 2.4, 2.5 kg is absolutely fine. Any Indian average baby at the time of delivery, we expect the baby to be somewhere between 2.5 to 3 kg. So 2.5 at 36 is little more actually.
Thank you, doctor. Next question by Shweta Rajendra. She had DNC before 20 days. Now only today she got light bleeding. Is this period or any other problem? Can she get period as soon as 20 days?
Maybe after a DNC, there could be irregularity in your bleeding pattern. So getting in 20 days is quite okay. Probably we'll wait for the next menses. If it again happens irregularly, probably you have to meet the gynecologist. Otherwise, if it is a regular frequency, then just leave it alone.
Thank you, doctor. Shweta's question, she's in 15th week of pregnancy and the last menstrual cycle started on 19th February. Last month on 18th, she got the NT scan done and it was told that she's 13th week pregnant. Okay. She got, okay, I think
Yes, I
she's
think
asking
15
about,
weeks of pregnancy, and in the last NT scan, they've corrected it to 13 weeks,
right.
which can happen with some pregnancies if the conception has happened little delayed. Sometimes the growth will also be seen little delayed. So, and the doctors will correct the growth according to the correct the delivery date according to the growth seen in the ultrasound. So that is quite normal, nothing to panic unless and until the baby is fine. These corrections usually happen with a dating scan and an NT scan.
Yeah. And Shweta, you months and weeks, you can check it online. I mean, in the iMumz app also, we have a chart. You can check that. No need to ask it to doctor. All the best. Ankita's question, she's 8 week pregnant. Can she travel?
See, traveling at 8 weeks of pregnancy is something which we ask you to prevent because it's a very early pregnancy. And definitely traveling by air should be avoided. But traveling by road, if it is really mandatory, you can do. And traveling by train is also okay. But do the travel if it is really mandatory and it is not very long distance.
So someone commented that my voice is echoing. If it's fine, please, someone just give me a quick yes, so that I'll just check it. Next question we're taking from Isha. She asked this inside the iMumz app. She had done blood test at 6 weeks and the TSH is 8.455 and beta HCG level is greater than 1000 MIU per ml. Are these a cause of concern? The doctor prescribed thyroxine. Can it resolve the high TSH issue?
How much was the TSH? 5 point?
8.4.
6 point.
8.4.
How much was the TSH?
8.455 she mentioned, and beta HCG level is greater than 1000.
TSH.
TSH is 8.45.
Yes, definitely. TSH of 8.4 at the early pregnancy time is definitely higher. So you will have to take a thyroid supplementation, definitely.
Thank you, doctor.
Beta HCG value is okay.
Thank you, doctor. Next question by Dhwani. She asking, मैम मेरी 9th week pregnancy है, मुझे आज डार्क ब्राउन कलर का थोड़ा डिस्चार्ज हुआ है और बॉडी में वीक फील हो रहा है.
How many weeks of pregnancy? 19th week. 9th week. I think discharge or bleeding, I'm not sure. If it is a simple white discharge, I think you need not be bothered. Probably you can have a gynec checkup to see whether you have any infection. If it is a bleeding, red color, pinkish discharge, again, you have to meet a doctor to make sure that it's not a threatened abortion. So you will have to either way meet the doctor if the discharge is again and again happening.
Thank you, doctor. Next question by Nadia. She had the viability scan and found the heartbeat. And doctor said everything is fine, but severe ear dullness and cold headaches frequently she is getting. She's worried if she can use the medicines in the first trimester. Is cetirizine safe?
Cetirizine is quite safe, but taking an antibiotic, probably you should take an advice from your gynecologist depending on what kind of antibiotic is prescribed to you. Preferably you can meet a doctor and say that you're pregnant before you get the medication. Taking cetirizine is fine.
Thank you so much, Doctor. Next question by Ravi Jain. His wife is 36 weeks pregnant from the last 1 week. I think Ravi Jain has a similar question like Surabhi Chaudhary. Okay, 194.
I think it's the same
Yeah, I think it's the
question
same
is
question.
repeated
So,
again. Yeah.
Ravi, I mean, your wife has already asked the question, we answered. So, Sakshi Kapoor, she's 30 weeks pregnant and the baby weight is 1300 grams. Is it less? How can I improve?
30 weeks pregnant and baby's weight is 1.3 grams. I think by 30 weeks, 1.3 grams is absolutely fine. I think by 28 weeks, we expect 1 kg baby, and 30 weeks, 1.3 and 1.4 is absolutely fine. I don't think you have to be really bothered to improve the weight of the baby right now.
Thank you, Doctor. Madhura Bhargavi has commented, so good to see you here, Doctor. Neha Khatri's question, 32nd week baby weight is 1677 grams. Is it okay?
32 weeks and 1.6.
Yeah. And she's
I
also
think
having amniotic fluid leak from 28 weeks since now.
Oh, it's still leaking. I think the baby weight is little fine. 1.6 at 32 is little more adequate amount of weight. And amniotic leaking from 26 weeks till now, 32 weeks, I'm sure you should be under a proper guidance. Otherwise, taking from 26 to 32 weeks itself is little tough. And I think you're fine to go ahead with the pregnancy if the leak is under control. If the leak is happening more, I think you will have to be delivered. So I'm sure you're taken care by some gynecologist there.
Thank you, doctor. Next question by Vivid Das. She had the ultrasound today morning. She's 7 weeks pregnant, and she got 87 BPM heartbeat and synchronic bleed. Threatened SO of threatened abortion. Doctor suggested the progesterone tablets. Okay, symptoms of threatened abortion maybe. Doctor suggested progesterone tablets and some injection and said there is very less chance for the baby to survive. Kindly suggest.
Okay. I think she's early pregnancy with bleeding. I think HCG and increasing the progesterone tablet supplementation will definitely help you. Probably two different progesterone, the synthetic and natural progesterone, both can help you. But we have to wait and watch for another 1 week. Probably after which you have to repeat the scan, and depending upon what we see, probably the growth, if it is fine, I think should be fine to go ahead with the pregnancy. But if the growth is reduced or there's no heartbeat or the bleeding is more, definitely you will have to immediately go and meet the doctor and follow what the doctor says.
Thank you so much, doctor. All the best. Beena's question: she's 13 weeks pregnant. Can she eat? Can she take egg? I think we lost Dr. Kavitha's connection. Hello? Yeah. Hi, doctor. Can you hear?
No, I'm here only.
Okay.
Yes, hello.
Yeah. So, Beena is asking,
Yes,
Beena is 13th week pregnant. Can she have boiled eggs or omelette? She's asking.
13 weeks pregnant, boiled eggs and omelets are fine, but weekly twice or thrice you can have egg whites. Egg whites are more important because they are immune boosters again. And taking more number of egg whites is good during pregnancy because it's more of protein. And you should definitely avoid eating too much of yellow.
Thank you so much, doctor. Next question by Renuka Sharma. What is cervix stitches and when they are suggested? Actually, she have a history of preterm delivery. Will it help?
If you have a history of preterm delivery, definitely cervical stitch might help you. which has to be given by 12 weeks of pregnancy. After your NT scan and double marker reports come normal, immediately it is better to do a cervical stitching. And if you had a preterm delivery by 28 weeks or 27 weeks, probably this stitch definitely could help you.
Thank you, doctor. This Sunday, we are having a webinar on the fatherhood, like to be fathers, and how, as a couple, you can bond with your baby. So don't miss this session. Next question we're taking from Swati Bishwas. Swati's question, she is
10
10
weeks
weeks
pregnant and 32. Can you read it?
Yeah. Her age is 32 and the weight is 67 kgs and height is 5.3. She's having a history of high blood pressure. She's on Lebetalol 100. What precautions she need to take? Weight is increasing without having junk and oily food. Sorry. Lost 10
See, 10
kgs.
weeks.
4 months.
10 weeks. Okay, last.
She lost 10 kilograms just before conception, she mentioned. Now the weight is increasing without junk food and oily food.
Okay. I think you're very much in an early pregnancy level. You're not even crossed your 3rd month of pregnancy, and now you're a hypertensive with on medication. Please keep your weight on check. Don't gain too much of weight and control your diet. Reduce salt intake in your diet and reduce too much of carbohydrates and sweets. And always keep a check on your weight gain. Probably a preferred weight gain would be a 1 kg per month, not more than that. And just maintain that and keep taking the hypertensive drugs regularly, so that if your BP is under control, I don't think weight and BP is under control, I don't think you will have any difficulties during pregnancy.
Thank you, doctor. Next question by Neha. She's 6 weeks pregnant and undergone ultrasound 2 days back. The result is simple cyst of size 30 cross 40 mm in the right ovary is found. Very minimal perisac fluid is found. What exactly are these?
During the early pregnancy, we will definitely see a cyst in the right ovary or the left ovary. These cysts are called corpus luteal cyst. So these cysts will be there to support the pregnancy. They will supply a hormone called progesterone to support the pregnancy. So you need not worry about the seeing these cysts. These cysts will disappear on its own, and it will not trouble you. So don't worry.
Sorry, I missed this. She also mentioned that fetal pole is appeared and she's really worried about the cyst and minimal perisac fluid. Yeah, okay. Your question has been answered, Neha. All the best.
Yeah.
Next question, Shubhangi. Today she completed 8 weeks but didn't have nausea and vomiting symptoms. Whether it is fine or not.
Today she's completed how many weeks?
8th week of pregnancy she just completed, but she didn't have any nausea, vomiting, any symptoms such like
Okay,
that.
she didn't have any nausea, vomiting. I think you're blessed not to have nausea and vomiting. I'm sure, like, I mean, sometimes when you don't have any symptoms at all, that itself will give you some panic. So don't worry. There are few women who will never have any early pregnancy symptom at all. So maybe you're one among them. Don't worry about it. I'm sure the baby should be fine.
Yeah, congratulations. Renuka ji, your question has been answered. Yeah, I saw you posting again. You can just go back and see your answer. Your question has been answered. Next question, Shruti. Can she travel 800 kilometers by road? Currently, she's 15 weeks pregnant.
See, Shruti, if it is really a mandatory travel, please do it. 15th week of pregnancy is you're still in an early pregnancy level only. And if you have to travel 800 kilometers by road, it will definitely give you a lot of tiredness, backache. Maybe you will have a foot swelling and all that. So it unless and until it's a really mandatory travel, don't do it.
Thank you, doctor. Zikra Sheikh, she is in 20th week now, but she have not gained a single kg in this 20 weeks. She's tensed about it. What to do?
Okay. In pre-pregnancy, But if you're a little on the obese side, if you're not gained during the initial 5 months of pregnancy, that is fine, because already you have a large amount of reserve in your body, which will be used up by the baby. But if you're very much on the leaner side and you're eating adequate amount of food, and then you're not gaining weight, again it is okay, because you're eating adequate amount of fruits and vegetables. Sometimes they'll have a very good diet, like more of fruits and vegetables, avoid carbohydrates and all that. So those kind of people will not gain weight, but they'll be healthy. So if you're in that group, I think that is also fine. But if you're very thin and you're not adequately gaining weight and you're malnourished and your hemoglobin is very less, that is not right. You have to meet the doctor. Please increase protein in your diet, and vegetables and fruits is a must in your diet. Have adequate amount of protein, you might start gaining weight.
Thank you, doctor. Next question by Shubhashina Sahu. She was suggested to go for IVF before conception, but while undergoing treatment, she got conceived naturally and got the result on 10th May. The doctor had asked her to maintain 500 Corion 2000 injections, sustained 200 mg, and some folic acid tablets for the 3 months. She had taken them for 3 weeks. Should she stop, or should she continue?
If you're in early pregnancy, you've been a patient who was planned for IVF, and I think this lockdown has helped you in having a natural pregnancy. So please continue the medication which your doctor has given. That is absolutely required for you. So continue the medication till your doctor says okay to stop.
Thank you so much, doctor. Next question by Umama Apurun. She's 9 weeks pregnant and she was going through some mild fear and stress. And as she's going to sleep and taking rest, she's feeling a muscle twitch and can't sleep because of that. Any harm for the baby?
If the muscle, I think you're going through some mild fear and stress. I'm not sure whether it's because of pregnancy or you have any other family issue. If you have any family issue, please address it, meet a counselor, get yourself counseled out of the fear, and bring the fear out. Otherwise, it is going to affect the entire pregnancy. The other thing is the muscle twitch. If it is just happening once or twice, it is okay. Please drink adequate amount of water, hydrate your body, and take a lot of electrolytes in your everyday liquids. Please add a lot of electrolytes. But beyond that, if you have repeated muscle twitching, sometimes you might require some supplementation, which you have to meet the doctor and get it.
Yeah, thank you so much for stressing the importance of family during the pregnancy, doctor. So this Sunday, because of the same, we have an expert. Please join with your husbands. So an expert will explain everything what you are undergoing and how they should understand your pregnancy and be a part of pregnancy. And they'll also explain the role of the bonding with the father of the baby inside the womb. So this is going to be a very, very interesting session. Don't miss this Sunday. We have a webinar. This is a part of a baby care program. You can just subscribe to the program and join this session. So this is going to be very important. And so ask the to-be fathers to join this session on this Sunday from 4 to 5 p.m. Next question we're taking from Dhruti. She's 16 weeks pregnant and she have abdominal pain and pain in the lower stomach, both the sides sometimes. Is it normal?
Yes, Shruti, I think many women have this doubt because you are in the 4th month of pregnancy. This is the time where the baby increases in its weight. So definitely you will have a increase in size of the uterus. So you will have a pull, a dragging kind of sensation, and always a heaviness in the lower abdomen, which is quite normal at this point of time.
Thank you, doctor. I just missed it. Yeah. So, Snehal's question, she's 7th week pregnant. When is the right time to have the first sonography done?
I think, Snehal, I think you should be doing your first ultrasound by 8 weeks of pregnancy, because that is the right time to date the pregnancy and confirm your delivery date. So you should have your scan by next week.
Thank you, doctor. Akriti, she's 34 weeks pregnant and her hemoglobin level is 9.5. The doctor has given her speedal iron tablet and vitamin C, lime C. Do I need to do anything else? It's a question.
How many weeks of pregnancy you said?
34th week of pregnancy currently. Hello, can you hear, doctor?
How many weeks of pregnancy?
34,
34 weeks.
34.
And okay. So, so vitamin C supplementation is it can be taken because it will improve the iron absorption during the pregnancy. So if you're a little anemic, probably your doctor would have supplemented vitamin C, which will improve the iron absorption. So that is right to take.
नज़िया खान्स क्वेश्चन, क्या आईवीएफ प्रेगनेंसी में सी सेक्शन करना ही पड़ता है? नॉर्मल डिलीवरी नहीं होता है क्या? प्लीज आंसर, आई एम वरीड.
Can you tell me in English?
Yeah, so sorry. I was going to ask. So, is it mandated to have a C-section through IVF pregnancy? Normal delivery, is it not possible at all? She's worried about it.
Okay, IVF pregnancy, everyone consider it to be very precious. The baby is going to be precious. If you're a very young woman, recently married but gone through an IVF, you can have a normal delivery. If you don't have any complication during pregnancy at all, you can have a normal delivery. But if you're married for many years and it's a long-term infertility, your age is more than 35 years, and you have medical complications along with IVF pregnancy, definitely it is better to go for C-section. But if you're a young woman with recently married and the problem was only with the husband, you were perfectly all right before and after the pregnancy, definitely you can opt for a normal or natural delivery.
थैंक यू डॉक्टर. नजिया जी, डॉक्टर कविता जी का कहना ये है कि अगर यदि आपके साथ कोई कॉम्प्लिकेशन नहीं है, आप यंग है, तो डेफिनेटली नेचुरल डिलीवरी संभव है. आपके डॉक्टर डिसाइड करेंगे. तो ऑल द बेस्ट. नेक्स्ट क्वेश्चन वी टेक फ्रॉम रितु गोयल. हेलो डॉक्टर, मेरी चेस्ट के नीचे लेफ्ट साइड पेन हो रहा है. शी इज फेसिंग पेन in the chest area, lower part. काफी कल से अलग अलग लग रहा है, जैसा गोली से टिका सा पहन लिया. The pain is much more from yesterday. What can she do? She's asking.
I think she's meaning a left breast pain or chest
Yeah,
pain. I'm not sure, but
pain,
if it is a pain which is not increasing, I don't think you have to do anything for that. You can just take rest and maybe it will subside on its own. But if the pain is continuous, it is really unbearable, probably you will have to meet the doctor. The doctor has to examine the area before they give you any medication.
Yeah, she's 6th month pregnant. She's saying that pain is feeling like a sharp. It's pain is like a sharp pain.
See, any pricking kind of pain or a sharp pain which comes and goes off now and then, or maybe it stays for 10 minutes and goes off, probably that is fine. That could be normal. But if it is unbearable, it is like increasing in intensity as time goes, or every day there is an increase in intensity of the pain, probably you will have to meet the doctor. Otherwise, if it's a pricking pain and it goes off by itself, then you can wait and watch.
थैंक यू डॉक्टर. रितु जी, डॉक्टर कविता जी का कहना है था कि यदि आपकी पेन बढ़ रहा है समय के साथ, आप आपके डॉक्टर से संपर्क कीजिए. अगर नहीं बढ़ रहा है, कभी कभी आ रहे दिन में 10 मिनट, वो अपने आप चला जाएगा, तो उसमें इतना घबराने वाली बात नहीं. Ruby Mishra's question, she is 16 weeks pregnant with twins. She wanted to travel to the hometown by personal car, approximately 7 hours journey due to an emergency. She need your advice.
Definitely, as I told for the people, if it is really mandatory travel, please do, because 7 hours travel by road will definitely cause some discomfort to you, back pain, lower back pain, probably you will have a foot swelling and all that. But if it's an emergency, you can travel, but travel safe.
All the best, Ruby. Next question by Vaishaki. She asked this inside iMumz app. After taking Niftas 100 mg for days after UTI, she have redone the urine test and not showing 10 to 15 pus cells. She's 36, age is 36, weighing 90 kgs, and in the 20th week of pregnancy. She want to know how to avoid UTI with home remedies, as Niftas is giving her nausea.
See, I think Urinary infection is very common during pregnancy. This is very, very important to keep ourselves away out of urinary infection. So drinking adequate amount of water. Make sure that you have 2 to 3 liters of water every day. Measure and take the water liquid amount, and probably add tender coconut, buttermilk. So these kind of liquids can prevent you from having urinary infection. And also taking cranberry juice, maybe it will help you with home remedies of preventing urinary infection. And also look at your vaginal infection. If you have repeated vaginal infection, it can in turn cause a urinary infection. So avoid any infection in that area.
Thank you so much, Doctor. On the same note, tomorrow we're having a wonderful session with Dr. Narendra Malhotra ji on infections, 5 common infections in your pregnancy and how do you deal with them. So please join that. So Dr. Narendra ji will also be talking about urinary infection, which is very common, as Dr. Kavitha ji has mentioned. Next question we take from Dr. Shaista. She's 14 weeks pregnant today, and her urine analysis test did yesterday, and the report says she's having pus cells 3 to 5, epithelial cells 8 to 10, and calcium oxalate crystals in the urine. Please help.
Shaishta, I think your cells, a minimal amount of cells you have and epithelial cells you have, probably you might have a mild urinary infection. Please drink adequate amount of water. As I told you, please increase your water intake. 2 to 3 liters of liquids per day is important, and please void urine frequently. Don't hold the urine for a longer duration. Empty the urine very frequently, and make sure your urine is not yellow in color. It should be very clear, colorless. If you maintain this, I don't think you will get into urinary infection repeatedly.
Thank you so much, Doctor. Next question we take inside the iMumz app. Mrs. Agarwal, she's 30 weeks pregnant. Her baby is staying below the navel most of the time and she's feeling cramps and pain. Is it normal?
Below the navel baby, that is okay. That is not a matter. Cramps and pain, if it is bearable, it is okay. Even in a normal pregnancy, very uncomplicated pregnancy, everyone will have at least 2 to 3 times contractions during pregnancy. It's called Braxton Hicks. So tightening, then relaxing might happen once or twice in a day. That is okay.
Thank you, Doctor. Shweta's question: calculation of pregnancy depending upon LMP or according to the growth scan?
I think not according to the growth scan, but if you had undergone a scan by 8 weeks or 11 weeks and they had corrected your delivery date, please take that. If that time the baby's growth was corresponding to your LMP, please take only your LMP measurement. I'm not sure, but don't correct your delivery date according to the growth scan.
It's actually my mistake. She mentioned, is it according to the baby's growth in the scans? I just read it out as a growth scan. Sorry for that, Shweta.
Yes, probably if the scan was done early, like 8 weeks or
Right,
11 weeks
right.
or 12 weeks scan, and they're correcting it, it is according to the growth.
Yeah. Thank you, Doctor. Next question by Shireen. She's 16 weeks pregnant. Doctor told to do blood test yesterday, and she did it. And the leukocyte count is 13,400 per CU/mm, and the normal range is 4 to 10,000. Is it okay?
That is okay. That is okay. Mild white blood cell elevation is there, but sometimes we do see that during pregnancy. If you don't have any infection or any symptoms like urinary infection, I think it's okay.
Thank you so much, Doctor. Next question by Barkha Gupta. She's 27 weeks pregnant. She's having problem of white discharge, which is watery, and having this issue mostly in the alternate days. Is it something to be concerned?
Okay, if it is repeatedly happening, I think it is better you have a checkup or examination with your gynecologist. Please tell them. You might require some medication to control. If there is an infection, you might require some medication.
Charu Gupta, she's in 34th week of pregnancy and she's having vaginal itching problem. So she's asking, should she go for a C-section or a normal delivery?
Vaginal itching problem.
Yes, doctor. And she's in 34th week of pregnancy.
I think vaginal itching it can happen with anybody, and if you have been having vaginal itching for a longer time, I don't think that is an indication for C-section. You can go through a normal delivery.
Thank you, doctor. Sangeeta, she's having itching near the vaginal area once in a day. She have consulted doctor, and the doctor gave me Cloben G cream. But after 1 2 days, she's feeling the same problem. What should she do? She's 19 week pregnant.
See, Cloben G is for vaginal itchiness, but if I think you mentioned about vaginal pain. Vaginal pain can be normal during
You
pregnancy.
mentioned
That
vaginal
is
itching only,
nothing
doctor.
alarming unless and until it's a very mild, bearable one. If it is vaginal itching, definitely continue Cloben G for a few more days. Like at least for 10 to 15 days, please continue the cream. And vaginitis is something which can recur for any woman. So probably whenever you get that recurrence, you might have to get treated.
Thank you so much, Dr. Isha Jain. She's 7th month pregnant and the amniotic fluid is 8. So is it a matter of
7th month of pregnancy and amniotic fluid is 8 is a little borderline fluid level. Definitely, you please consult the gynecologist. They might put you on medication to improve the amniotic fluid level. Probably hydration therapy you can follow, which is like taking at least 3-4 liters of liquids per day. Might improve your amniotic fluid level. But if it doesn't improve, maybe the doctor might decide to deliver. Or if it is reducing, maybe the doctor might decide to deliver you.
Thank you, Doctor. Anita Singh, she's 9 weeks pregnant. She wants to get an advice from nausea and morning sickness.
Nausea and morning sickness is quite common, and in a good sense, if you want to take your baby is fine, that is why you have nausea and vomiting, so be happy for that. And this nausea and vomiting will definitely change after a month. So every month it is going to be a different scenario. For now, you can have ginger in your diet can reduce your nausea. And also you can take vomiting anti-vomiting tablets from your doctor, which can definitely prevent you from having too much of vomiting and vomiting sensation.
Thank you, Doctor. Shweta has a question. She's 19 weeks pregnant and she's feeling stomach ache. And will it be a problem someday? She's asking. She's 19 week pregnant now.
I don't think if it is a mild heaviness or pulling kind of sensation or dragging kind of sensation, I don't think you have to be bothered about this stomach ache. But if it is very much higher in intensity, probably you will have to meet the doctor, because someone has to examine before telling that you're normal.
थैंक यू डॉक्टर श्वेता जी कविता जी का ये कहना कि अगर हल्का सा पेन है तो कोई दिक्कत नहीं है शी सेइंग दैट समटाइम्स इट एग्रीवेट्स समटाइम्स इट्स मोर
See, during pregnancy, you will have pain here and there. You can't be completely normal. That every pregnant woman should understand that. Even the smallest change in your body, please don't panic, because pregnancy, every day you will have a different symptom. So any pain, any pricking kind of pain, any pull which comes and goes off, or maybe it will be there for once or twice a day, every day, probably that is okay, unless and until the doctor examines you and the doctor says everything is fine. Please don't panic. You might will experience some pain here and there every day. Don't panic for every small thing.
या थैंक यू डॉक्टर श्वेता जी डॉक्टर कविता जी ये कह रहे हैं कि गर्भावस्था में इधर उधर कभी कभी दर्द आना तो बहुत कॉमन चीज है जब तक आपके डॉक्टर कहते नहीं कि ये कुछ घबराने वाली बात है तब तक आप चिंता मत कीजिए उसको लेकर और आपकी प्रेगनेंसी को एंजॉय कीजिए नेक्स्ट क्वेश्चन बाय भुवना she's in 5th week of pregnancy and she took beta HCG test and the value is 1005 and after 48 hours it is 1628. The doctor said it is low. She's concerned about it and she saw in a website doubling in 72 to 96 hours. Please explain.
See, I think the doubling should happen in 48 hours. So what we see, instead of 2,000, I think we are seeing 1,600, which is a little lesser value, but 72% doubling is also fine. For some pregnancy, it can happen, but probably we have to follow up you, and probably we will have to do a repeat beta HCG or do a scan after 2-3 days.
Thank you, Dr. Rashmi's question. She's 10 weeks pregnant with twins. During the night, she feel some pulling sensation in the abdomen and also mild cramps. She's taking sustained 200 tablets twice a day and sustained injection once a week.
See, I think, as I told you, some mild changes, a pulling, a dragging, a pricking, or a tightening kind of change in your lower abdomen during pregnancy is quite okay. It can happen. But again, you're taking progesterone tablets. So I think you need not be bothered. If the pain frequently happens and it is unbearable, probably have a checkup with your doctor.
Thank you, Doctor. Vaishnavi, during pregnancy, mobile phone uses and mental stress, will it affect the baby? Will it have any health issues on the baby?
See, definitely mobile phone usage has to be reduced by any pregnant women, because we don't know how much the harm can happen, because the waves which are emitted from the mobile phones can definitely affect, but probably you have to reduce your mobile phone and the screen time as much as possible during the pregnancy. But whether it directly affects the mental well-being of the baby is yet to be studied.
Thank you, Doctor. Vaishnavi, you can listen to the music and the baby bonding exercises which are there in the iMumz app, for the mental wellness of you as well as your baby. Next question, Mahi Anand, she's 8 weeks pregnant. Can you please suggest the right diet for me? Which fruits or vegetables are good for me?
I think fruits and vegetables, there's no restriction. Whichever the fruits you were used to taking, please take. Don't introduce anything new to your diet. I generally say that to my patient, because they suddenly read something and introduce something new to the diet. Sometimes you might not be happy with that. But take a lot of vitamin C containing fruits, apples, pomegranates. And I would suggest you to reduce mangoes, red bananas, because they're all very much high in the sugar levels, sweet levels. So reduce such fruits, but otherwise you can take any fruit which is comfortable for you, and add more of vegetables in your diet. I generally advise 2 cups of vegetables in your diet for your lunch, and 1 cup of rice. So let your carbohydrate be lesser than your vegetable intake. So if you maintain this, I think this is a balanced diet. You will not gain too much of weight. At the same time, you will be healthy.
Yeah. Thank you so much, Doctor. Suma's question, she delivered on 17 May and she got high BB from April during the pregnancy. Still, it's not reduced. It's 140/100. She's still on medication for blood pressure. Kindly advise, will BB continue? And if it does, for how long?
See, I think you delivered on 17th May. June 17th or end of June, you have to be little careful with your BP, because after your delivery 6 weeks, it is still called postpartum. You're still under the pregnancy effect only. So till then, you have to take care of your medication, and you have to monitor yourself.
Thank you so much, Doctor. Akila has 2 questions. One, how much weight should be there in the 7th month of pregnancy? I don't know, weight of baby, I guess. And is gender depends on heartbeat, like 140 or below and above? Is there any relation between heartbeat and the gender?
I'm not sure. There's a myth. I don't know whether it's a myth, but I don't believe in that. As a medical person, we don't have any relation of gender and heartbeat of the baby.
Thank you so much, Doctor. Shall we take the next question?
Pardon?
Shall I take the next question? Or
Yes.
yeah, okay. Revati's question, she's 17 weeks pregnant and second pregnancy. From 15 week onwards, she started feeling slight movement often, but from the last 2 days, she's not able to find any movement. Is it normal in early stage?
See, 17 weeks feeling a movement itself is a very good thing, because generally your movements are felt better after 20 weeks. For now, don't worry about not feeling the movement. Definitely after 20 weeks, you will feel it better.
Thank you, Doctor. Next question by Akanksha. How safe is it to take Ecosprin and Thyronorm 12.5 mg during the pregnancy?
Ecosprin is very important. Sometimes Ecosprin is started to improve the blood flow from the mother to baby. So if you have a pregnancy loss previously or history of high blood pressure or diabetes during pregnancy, definitely maybe the doctors would have started you on Ecosprin. Nothing wrong in taking.
Again, question by Shweta, 19 week mein, okay, I'll translate. So, white discharge is it normal in 19th week of pregnancy, and will it harm the baby in any way? I mean,
I think
will
we
it be
discussed more about this. White
right,
discharge, definitely you have to get checked and
right,
treated for that. Repeated white discharge should not happen. Definitely it will end up having a preterm delivery. You should
right?
prevent that.
Yeah. Thank you, doctor. And she has another question. Is it okay to have sex in this period, 19th week of pregnancy?
It is okay after the first trimester. We generally advise you can have a sexual intercourse, but it is absolutely under your control. If you're comfortable doing it, please do it. If you're finding it difficult, you have a pain or some bleeding after the intercourse, you have to avoid it. It is not mandatory.
श्वेता जी 19 वीक में प्रेगनेंसी में आपको वाइट डिस्चार्ज यदि हो रहा है तो आप आपके डॉक्टर को संपर्क कीजिए और इंटरकोर्स 19th वीक में कर सकते हैं यदि आपको कोई ब्लीडिंग और यदि कोई दूसरा समस्या नहीं हो तो. Next question by Neelam Yadav. She's 26 to 27 weeks pregnant and she is not able to feel the movements of the baby yet.
How many weeks? 27 weeks and not feeling the baby movement is usually generally everyone feels by that time. If your placental location is little anterior, maybe some women cannot feel the baby movement effectively. And if you're very obese, again, I've seen many women not feeling the baby movement effectively. But don't worry about it. Probably after your breakfast, lunch, or dinner, turn to your left side and lie down for 1 hour and monitor the baby movement for 1 hour. If you're feeling 3 movements, that's enough. If you're not still feeling, probably you have a checkup with your gynecologist.
Thank you, doctor. Can yogurt and mango, can she consume
Ravi,
yogurt
I think my charge is gone.
Okay, yeah.
That
We
is.
are just finishing. Yeah. Okay,
I
doctor.
hope it doesn't get
Right.
disconnected.
Yeah. The last 2 minutes also.
Yes.
Mango you already covered. Yogurt can she have in pregnancy? Yogurt.
Yogurt is fine. Curd and yogurt, I think it's fine during pregnancy because it has got a lot of calcium in it. You should have.
Right. So last question of the day. Will baby heartbeat start by 6 weeks or 7 weeks of pregnancy?
6 weeks. It
Great.
starts from 6 weeks of pregnancy.
Yeah. So the last 1 hour has been incredible. Thank you so much. There are so many thank you messages, doctor. I didn't show because of time scarcity. Thank you so much, doctor. It's been a wonderful session. Any last message would you like to share with all the pregnant women out there, all the viewers of iMumz?
Okay. See, pregnancy is a very enjoyable time, so don't panic. Eat healthy food. Don't eat too much of junk food. Have a balanced diet, more of fruits and vegetables and less of rice and sweets. And I generally say reduce 3 whites. That is, one is rice, one is sugar, and one is to not to take too much of milk. 2 cups of milk a day is adequately enough. There are women like who take a lot of milk. I just want you to control your weight also. So gaining just 5 to 10 kgs of weight throughout the pregnancy is adequate enough when you're having adequate amount of nutritious diet. So, and do some regular exercises. Doing household activities is very important. Please do the brooming of floor, whatever household activity you can do at home, please do it. And also do the pregnancy related exercise classes. Please join those classes. Try to motivate yourself in doing some physical activity. So right diet, right physical activity, right exercise, probably you will not end up having any medical issues during pregnancy. So everyone have a safe and healthy and enjoyable pregnancy.
Yeah. Thanks for such a beautiful message, madam. A big round of applause, everyone, for Dr. Kavitha ji for taking a time to interact with all of us and answering all the questions, concerns in a very positive way. Thank you so much, doctor. We would love to have you sometime again soon with us.
Yes, I will. Thank you.
Thank you so much, doctor. Have a nice day, everyone. Yeah.
Yes.